We're all in this together. How many times have you heard that lately? It's become a social anthem recently because in times of need, we rally together and support one another. But what happens when that support has to happen by staying apart, social distancing, isolating? Since the dawn of humankind, we've gathered in tribes. Social connection is part of our evolutionary makeup. Being socially connected through good times and bad is key for our health and happiness. But how does social connection, or the lack of it, impact our well-being?
The social aspect for someone who's retired like me, go to the gym, go to the pool, visit my friends, that's been really tough.
Well, it's very important. I'm finding that the hours at home are very long.
I think it's very important, and I'll speak for people with disabilities. It's being connected to the community is a lot.
Human beings are social animals, so we have to be socially connected.
Chris Fowler knows the importance of social connection. As COVID-19 intensified around the globe, he launched Queensland's Adopt a Healthcare Worker page, a forum dedicated to supporting those who support us.
Being able to be connected either through social networks or through personal groups is incredibly important. And for a person's own mental health, I can tell you from my personal experience that when I felt really isolated, just reaching out and saying hi to a friend, it drastically helps. I implicitly believe humans are good, and it's the core thing I teach my kids and why I send them around the world with me, because you get to see everyone smiles the same.
The page has since gathered over 21,000 members.
Facebook especially is zero barrier of entry. Everyone has it. So it was very easy to get people to join and to contribute, and it helps empower people. I was looking for something to do. I'm literally stuck at home with no way to contribute, and I was looking for an outlet to help the healthcare workers, and there wasn't one. So I made it. And everyone got that opportunity to just give, even if it's just a message. It was so important. So many people went out of their way, more than I could have ever imagined. While it might be virtual, it's still connected, and it's still real people talking to real people.
Researchers found that social relationships at both an individual and community level are vital for our physical and mental well-being. In fact, they can help prevent illness and may even add years to our lives. Social inclusion, support, engagement, participation and networks can help foster opportunity, a sense of purpose, belonging, dignity and even fulfilment in all of us. Social worker Elise Ma also enjoys helping others reap the benefits of social connection. She's taking part in an Australian first initiative called the Ways to Wellness Social Isolation Project. Elise's role involves connecting people to social groups, catering to every conceivable interest. How do these activities actually help with social isolation?
Physical activities are going to improve our physical and mental health and well-being, and I can certainly assist with linking people into those exercise and fitness groups, walking groups, sporting clubs. But it's the sense of belonging and inclusion that comes with being part of a group that I think really has the most benefit to people who are experiencing social isolation and loneliness.
The Ways to Wellness Social Isolation project began in 2019 at Mount Gravatt in Brisbane. It's open to anyone, but you need to be referred by your GP.
I think what sets us apart from other services is that I can provide that literal hand holding for people. So not many people enjoy walking into a group of people that they don't know or participating in activities that they've never tried before. So I can come along with them, I can introduce them to the facilitators and I can participate with them. So it just ensures that they have a positive experience and they're not doing it on their own.
Harshpreet Singh Kohli is also passionate about doing what he can to build happy and connected communities. For him, it's not through social work, but through food. During COVID-19, he donated his time as a driver, delivering free hot meals and groceries to people in isolation.
We buy the groceries from Indian store, bring it here, and the chef, who was very generous, he's been helping us preparing all the meals with no cost.
So it's a lot of people coming together, isn't it?
Yes. It's not a one-man show. And at times of where it is needed, we certainly have to do all these things.
Hushpreet's the Brisbane coordinator of Turbans for Australia, a national Sikh charity helping anyone in need.
Culturally speaking, why is this so important?
There are three pillars of Sikhism: one chako, kir karo, and naam japo, which means remember God, share your meal, so whatever you have, share it, and kir karo is honest living.
From a social connection point of view, why is this so important to you?
For me, it is, of course, helping is very much important. It's a pleasure which we get, in giving people. The reward, the acceptance when they receive any small things, the thanksgiving coming from them is very heart-touching. You want to serve the way you've been served. I've been just doing the things which humanity is there for, so just to help around.
Paul Tremaine knows the benefits of social connection to wellbeing. As a health coach with the Ethnic Communities Council of Queensland, he injects a healthy dose of community and group activity into his role.
How is boosting social connection and group activity important?
It's very important. Support and friendship is in group activities and group community groups is one of the most important determinants of success. I think that's one of the positive things about being in a group is they continually share amongst each other. They have someone to bounce their ideas back from. But it's also important for accountability that they be able to keep track of each other.
And you're holding me accountable today, so
yes,
shall we do
yes,
some exercise?
Of course we will.
Okay.
Yes. 1, 2.
And if group exercise isn't your thing, here are some other ways Paul suggests you can expand your network. Things like volunteering, joining a club in your local area, connecting with people online, getting involved in a community garden, singing in a choir, or even joining a health program.
Very good. Because we have to do the other leg,
Oh, really? That's right, accountability.
Jill has her own technique, that's good.
Our four-legged friends can also prove vital to wellbeing.
Hello, Reggie. How you going, buddy?
That's something Andrew Watkins, a clinical nurse in mental health, knows firsthand.
It's been really interesting moving up to the Sunshine Coast just at the end of last year after living my whole life in Sydney, and really I've come up with my partner, and we don't really know anyone on the Sunshine Coast, and I think one of the really big things that's made a difference has been able to take our dog Reggie out for regular walks each morning and evening, and we've got a local beach here that's off lead, and it's enabled us to meet lots of people that are other dog walkers and engage in conversation, and we've actually developed a number of friendships that way. Generally in society, when we approach someone else, we're not always confident, just start engaging them in conversation, but with a dog, people will come up to you and ask you about the dog, what's his name, or what breed is he, how old is he, and it is that classic way to start a conversation where things can continue on and you can start to build some rapport and friendship with people.
So, as you can see, we really are and always will be in this together. If 2020 has taught us anything, it's that humanity and compassion is all around. Our well-being depends on it.